Hi everyone. Wow, it's week 12 already. Only 4 more weeks left. I can't believe it's going by so fast. So I did watch the confidentiality video just to make that clear. So I work for a family resource center in Boston. That's all I'll say. So last week I had a training on Mass Health, which is the insurance that many of the families that we serve have. So it just kind of, the insurance in Mass is kind of very confusing. So this helped a little bit. I am still a little confused, so I'll kind of just go over it a little bit. So it goes over how, like, the Mass Health eligibility. So the standard for Mass Health is seniors with household incomes up to 100% of the federal poverty level, parents and caretakers of children under 19, disabled and medically frail adults up to 133% of the federal poverty level, children and young adults under the age of 21 up to 150% of the federal poverty level, pregnant women and infants, persons with breast cervical cancer up to 250% of the federal poverty level. So there's like a few different programs under Mass Health, which is Mass Health Care Plus, which is childless and adults with household income up to 133% of the federal poverty level. Mass Health Commonwealth, which is like disabled children and young adults under 21 with household income above 150% federal poverty level. So this one's more for disabled adults and children. Disabled adults above 133% of federal poverty level. And then, so it just talks about, she talked about how the different plans that you can look at based on your poverty level. So there's a grid here with that. So that's really helpful to look at, so we can kind of explain to families when they are trying to understand Mass Health. So who can select a Mass Health plan? Anyone under the age 65 with Mass Health as their only insurance and living in the community. And in the following Mass Health coverage types, so Mass Health Standard, Mass Health Commonwealth, Mass Health Care Plans, and also, so kids, DCF, so kids who go through the custody of DCF, they automatically gain Mass Health, which is really good to see that they just get that automatically. Or kids with special needs, they also are eligible for Mass Health, so that's really good. And then, so then it kind of just goes over the different primary care clinician plans, managed care organizations, which is only 2 in Mass now, which is really good because before there was so many. So there's Tufts, and then BMC, Boston Medical Health Net, that goes through the hospital over there. And then it kind of just goes over accountable care partnership plans, and this is a group of like doctors and hospitals and other health care providers who work together to coordinate members' care. So it's a new program that we have in Mass, and this helps like families just understand their program, and these people can help them navigate the different Mass Health programs that they're able to get. So there's also a fixed enrollment exception. Fixed enrollment, so the only exceptions are children who are in the care or custody of the Department of Children and Families, youth who are in the care or custody of the Department of Youth Services, newborns and children who are younger than 1 year old, members enrolled in the primary care clinician plan, and additional exceptions can be found at a website that's here. So no matter what your income is for kids in DCF, that they're able to get that. And they also, there's an enrollment period for that, but for this, like, they can enroll anytime if they are in DCF custody. So it was really interesting. Still a little bit confusing, but it did help a little bit. Are there any programs like this in other states where it's just kind of like the bigger insurance, health insurance for families who may be at the poverty level, in your states at all? I look forward to hearing your feedback. Thanks.